Good afternoon, everyone. I think we're going to go ahead and get started with the afternoon session. I'm Dave Williams. I'm one of the directors of the K12 program. And this afternoon, we have the opportunity that we only get once a year, and that's where we bring everybody together. The K12 scholars usually have their quarterly meetings with their home mentor, their scientific mentor, their PWLE mentor, and other people who may be involved in their projects. And so throughout the year, we have these quarterly meetings. But once a year, we have a chance to come all together, and we all get to hear what's the update on everybody's projects. In addition to all the mentors and the scholars that are here today, we also have members of NIH, the program officers, both present and former. And we also have Jacob's here. He's out there, but he'll be back in. Jacob is with Purpose, which is the organization, for those of you who are not familiar, is the organization that's kind of a central clearinghouse of information and pain education for patients, scholars, researchers, the public. So what we'd like to do today is take an opportunity to hear from each of the scholars. We're going to start with our new cohort of scholars who are just starting here in June. And so we'll hear briefly from them. They just have tiny little talks. And then after that, we'll be hearing from our second cohort of scholars. They will have little moderately level talks. And then at the end, our first cohort, they're now third years, will be presenting their research, and they will have longer talks. So why don't we go ahead and get started? Our first speaker is one of our new scholars, Mohamad Bittar.
Hello, everyone. My name is Mohamad Bittar. I'm a rheumatologist and assistant professor at Oregon Health and Science University in Portland, Oregon. I'm very happy to be with you here to talk about a few things. It will be a very short presentation. So I think we have to talk a little bit about our background in this presentation. So I'm from Lebanon, and I did my medical school at American University of Beirut in Beirut, Lebanon. And then I moved to Indiana University in Indianapolis, Indiana, to do my internal medicine residency. After that, I did my rheumatology fellowship at Baylor College of Medicine in Houston, Texas. And then I moved to Memphis, Tennessee. I've been all over the place. I worked as a rheumatologist for 3 years and a half, and at the same time, I did my Master of Science in Epidemiology at the University of Tennessee Health Science Center in Memphis. And then I moved to Oregon, OHSU, to focus on clinical research and work more on chronic pain research. My research focus is on chronic pain and axial spondyloarthritis. You will hear a lot about chronic pain, so I'm going to talk a little bit about axial spondyloarthritis. So what is axial spondyloarthritis? I've been talking about it for the past 7 or 8 years on a continuous basis. I'll talk a little bit about it today. So it is an immune-mediated inflammatory condition that affects the axial skeleton, SI joints, spine, and it can go to other parts of the body as well. The hallmark of this condition is inflammatory back pain. Patients develop low back pain, which can go to other parts of the body. It can also cause fusion of the spine, which can cause a lot of limitation of function, and it can lower the quality of life. It's important to differentiate between inflammatory and mechanical back pain. I know we always talk about pain, but we need to look at the etiology of pain and where is this pain coming from. So the first thing to look at is what is inflammatory pain and what is mechanical pain, because that can give us a lot of hints about the possible etiology of the condition. Inflammatory back pain is pain that starts usually in the morning. The first thing, it's worse in the morning. It gets better throughout the day with activity. It's usually very chronic. It can be associated with swelling in smaller joints, with morning stiffness that's prolonged, that gets better throughout the day. It can get better with anti-inflammatory agents. It can wake up patients in the middle of the night because of pain. And usually the opposite is true for mechanical back pain. Mechanical back pain, patients wake up relatively okay in the morning, gets worse throughout the day. They do not have a lot of stiffness in the morning and so on. So these features can help us think about the origin and the etiology of the back pain, where it's coming from. And this is very important to our colleagues. I know we have a very diverse group. We have physical therapists, we have primary providers, we have providers who see back pain in different disciplines. So this is for you. We developed recently referral recommendations by Spondyloarthritis Research and Treatment Network. And this to help providers to know where to refer patients and when to refer patients to rheumatology for timely diagnosis and treatment. Right now, we are combating delay in diagnosis in this condition. There is 7 years of delay in diagnosis between the age of onset and the diagnosis. Imagine how much patients they pass through a lot of burden and so on, and it can lead to worsened outcomes, and it can lead to chronic pain. This is not proven yet, but I'm hoping to prove it soon. So if you're seeing a patient who has chronic back pain, by definition more than 3 months, the age of onset, younger than 45, of course, it can be at any age, but usually it's younger than 45, and they have any of these features, or they can score 3 or more on these features, then please refer to rheumatology for a timely diagnosis. The features can be inflammatory back pain in nature, any X-ray or MRI findings of sacroiliitis, elevated inflammatory markers, B27 positivity, genetic marker, or any other features such as uveitis, psoriasis, and so on. Please help us diagnose them early. Now, moving on to the K12 project, how I knew about this is from my amazing mentor, Dr. Lee. I was sitting in a conference 2 years ago at the American College of Rheumatology conference, and Dr. Lee was giving an amazing talk, and at the end, there was a slide about the K12. I Googled it, I emailed the directors, and then I applied. I was like, this is for me, and thankfully I'm here. So I'm very thankful, I'm very happy that you are my mentor, thank you. And Dr. Barton is my primary home mentor. Sadly, she was not able to be with us today, but she is back in Oregon right now. Why the K12 project? Because it will give us important key features that we cannot find in other grant mechanisms, such as mentorship and focused training in chronic pain. And this is very, very important for success. I'm not going to talk a lot about my K12 project. We are still adjusting it a little bit. But I am very interested in studying chronic pain in AxSpA patients, actually in brain connectivity and brain responses in patients who develop chronic pain versus patients who do not develop chronic pain. So we think the hypothesis is there is a big difference between the two groups. And my ultimate goal is I want to develop 2 things. A model to maybe predict who will develop chronic pain ahead of time, instead of just cycling between very expensive and risky biologic treatments for inflammation. I want to be able to know ahead of time who will develop chronic pain and who will not. So maybe we can adjust the treatment algorithm and we can target chronic pain at the beginning instead of just waiting for a side effect to happen or a bad outcome to happen. My last slide is I'm very lucky to call 2 very beautiful cities home. The one on the left is Portland, Oregon, which I know Ryan know about. Both 2 pictures on the left are Portland, Oregon. On the right is Beirut, Lebanon. They share a lot of amazing things together, amazing nature, amazing food, and amazing people. I hope you will get to visit us soon in both cities. Thank you.
Questions? Very good, thank you. All right, next up, another new scholar for this year is Jan Mooney.
Hi all, thanks so much. So I'm Jan. I'm a new K12 scholar this year, and I want to talk to you a little bit about myself and then the area that I hope to focus in, really trying to go between people and policy and back again. I want to give a lot of credit to my mentor who's in the audience here, Dr. Sill, today, as well as the K12 mentors that I've been assigned to continue to work with. So I want to start with talking a little bit about this area that I'm interested in, and then I'll kind of work back and think about sort of where I came from as well. I started at the University of North Carolina at Charlotte, where I completed my PhD in health psychology. As part of that training, I did a practicum at Children's National Hospital in their hematology oncology area and psychology. And I think this really gave me a window into the experiences of patients with sickle cell disease, particularly adolescents and young adults, who are experiencing a lot of challenges, not only due to pain and chronic pain that they were experiencing, but in order to get diagnostics and treatment related to that. So I had a patient that moved just like a couple of miles over into Maryland from DC and lost her Medicaid access and wasn't able to get a diagnostic, MRI, or continued treatment to help her with pain management. I continued with a more generalist health psychology internship at Henry Ford Health, where I think that really expanded that understanding of how insurance and policy systems can really shape the way that people access care across areas like bariatric surgery, transplant surgery, and as well as internal medicine or primary care. So I think that really gave me a sense of, what might these patients be experiencing as they continue throughout their lifespan. I've just completed a fellowship, T32 funded, in pediatric non-malignant hematology, focusing on chronic pain management in youth with sickle cell at the Affleck Center for Cancer and Blood Disorders, which is at Emory University and Children's Healthcare of Atlanta. So I'm pleased to be mentored by Dr. Sill there, where I'll continue on as a faculty member. I think really what I took away from this is really this idea that systems really do shape the health that we have. And I think this is of particular importance to folks with sickle cell disease who are experiencing pain not only related to their disease mechanisms, but also chronic pain that might be related to disease, as well as more generalized and throughout the different contexts of their life. So I think I really want to start by talking about the focus of my project and give a little bit of detail around that, which is really trying to understand what these system-level barriers are for youth with chronic sickle cell pain and how do we address them in a way that's going to last. So we have, of course, many really amazing treatments. So I think part of this learning for me is around interdisciplinary pain science, which I think really highlights why the K12 program is so helpful to me in this way. Also to understand the policy impact of guidelines that are already out there. And to understand how we can use science communication and advocacy to help advance policies that are going to help folks access the pain care that they need in an equitable way. So my short-term objective here is really to understand what system-level changes can support pain equity, and I want to do that by trying to understand what do we already have in place and what do we need in order to get youth with chronic sickle cell pain the pain care that they need. And then in the longer term, what I'm hopeful is that I can investigate an effective implementation pathway. So how do we get from the experiences that folks are having in their everyday life to policies that are going to help them get the care that they need in the long term? And then how do we use analyses about the outcomes that that care is associated with to work back and figure out how is this actually impacting people and what do we need to do next? I want to give you a sense of some of the other work that I do outside of my main job. This is my family, my mom and my brother, my sister-in-law. I'm also now a fresh aunt, newly claimed. She's about a month and a half. I sadly don't have a picture of her here. This is my dog, Cora. She runs my life. This is a store that she likes to go to that is closed, but we just still have to stand in front of her anyway, just so she can make sure. I also like to rollerblade. This is a group that I rollerblade with and a skate we went on for my birthday. And then this is my little soccer team. Thanks so much.
All right, next up is Scott.
All right. Hello, everybody. My name is Scott Ravyts. I wanted to start off by just telling you a little bit about myself. I'm from a very small rural town in Belgium, and then when I was young, we moved to Houston, Texas, then moved around throughout the country several times. Just a little bit about my background, then a big part of my identity and me is my family. So we have a picture of my dog who always thinks he's a model. And then a very proud fact, my daughter was born just 2 months ago, so I feel contractually obligated to share pictures with everybody. She's doing great. A little bit about me kind of professionally. I got introduced to the chronic pain world clinically first. That was my first experience. I found it to be both incredibly rewarding and challenging, and saw sort of an opportunity to make more of a difference. And that's really what motivated me to pursue research in this domain. Ended up going to a clinical psychology PhD program, but that had more of a it was a health psychology program, but had a focus in sleep and aging in my particular lab. So I brought a pain interest to that. But as I graduated, I wanted to pursue the pain direction even more. So I completed a postdoc at Johns Hopkins University, focused on how do people recover from severe orthopedic trauma, and what are some of the roles of mental health, social factors that contribute to recovery. And so part of my interest in the K12 project is to really focus in more on the second line of research that I'm interested in developing. So looking at how does stress exposure, particularly things like social stressors, so things like feeling invalidated, stigmatized, ostracized, impact someone's risk for developing pain or from experiencing bad pain outcomes. And so some of the things I'm hoping to do as part of the K12 program are to take advantage of my wonderful home mentor's expertise in how do we measure stress and how stress gets under the skin to influence health outcomes. I'm hoping to, again, expand my kind of research line and develop more grant writing experience to hopefully sustain my research career going forward. Awesome. Thank you.
And the last first year.
Sorry, go ahead.
It's good. The last new scholar is going to be Antoinette Spector.
I just gotta do this. So you're welcome. My computer was.
if you really want to go.
Not to make you nervous or anything, Abby.
Thank you. All right, I am Antoinette Spector. I am assistant professor at the Physical Therapy and Human Movement Sciences Department at Northwestern University Feinberg School of Medicine. It's really long in my email signature too, as it is when I just said that. And as part of my role, one of the main reasons I came to Northwestern was to lead the dual degree Doctor of Physical Therapy, Masters of Public Health program. I have a winding journey, so that I'll try to do it very succinctly. As I was practicing in the car, I never could quite do it in 5 minutes, so I'm going to try my best. So I started as clinically trained as a physical therapist, did that for about 10 years, and my caseload just increasingly became chronic pain patients as time went on. And that's when I started to really be interested in the psychosocial aspects of pain. And had a bunch of kids in the process, and we moved back to Wisconsin, where my husband is from, and a really good mentor and dear friend of mine, I was talking to her about maybe wanting to go back and do some research and telling her my interests, and she said, well, have you ever thought about public health? And I looked at her dumbfounded, because I'm like, what is public health? I've never even heard of that, because that's not something we really talked about in PT in the early 2000s when I was going. And so I went back and I was like, yeah, that actually is exactly what I want to do. So I went back and I stopped clinical practice and got my PhD in public and community health, because I really wanted to understand, especially the social determinants of health, and using community engaged approaches. So did that, was fortunate enough to have a really great mentor who helped me understand social and structural determinants of harmful opioid use behaviors in women in particular. But I knew I always wanted to come back to pain because that's where my roots were, especially as a clinician. So started my first faculty position at the University of Wisconsin-Milwaukee and started to work with a group out of University of Florida to look at epidemiology of pain, social determinants of pain, which was really cool. And then I had the good fortune of meeting Dr. Lee when I got recruited to Northwestern, who's already been shouted out once. And she's like, wow, I think you should really talk to Dr. Ramsey Goldman, also a rheumatologist who works with women with lupus, or patients with lupus. There's a lot of pain disparities. I think you could really learn a lot from her, and there might be something there for you. And so that kind of all dovetailed into the work that I'm doing now for the K12, which I'll talk about a little bit more in a second. So in addition to my professional life, a big part of my life is my family. I have 4 children, ranging in ages from 16 to my 10-year-old, so 16, 14, 11, and I have a 10-year-old whose birthday was yesterday. And I love this picture because it all showcases their personalities. My son is the class clown. My little one is main character energy all day long. My 16-year-old is annoyed by our very existence. And then my middle daughter, who is just the quiet, sweet, goes with the flow kind of girl. I also like to travel, so that's a picture of me in Hawaii, in Maui, and then that's my rescue dog, a 2-year-old pit bull terrier mix, and things that I like to do because I have so much free time. But when I do have time, I'm really obsessed with hot yoga right now. I like to read a lot of books, a mixture of nonfiction and fiction, but the real world's getting a little too real these days, so I've started to get more into fiction as of late for an escape. And I also love to play basketball, but then I've gotten a little too old for that, so now I enjoy watching basketball. So college, NBA, I'm all into the WNBA right now. So if you want to talk to me about that, let's talk about it. So why am I here, though? There we go. So I came here again because I really wanted to move away from doing the epidemiology work, which was really about discovery and really understanding, to now trying to do more applied work that I feel like aligns more with my strengths as a clinician and understanding, trying to develop interventions for people at high risk for chronic pain, as particularly vulnerable communities at high risk for high impact chronic pain. So I'm working with my home mentors, and I just met my, my primary mentor for here, and my overarching goal is to develop equitable and effective interventions to address pain interference. And my K12 project is largely focusing on engaging with key stakeholders in the lupus community and looking to tailor an intervention and test the feasibility and acceptability of a virtual intervention for that community to try to reduce the pain burden in that population. So that's it.